In a project that was done in a low-income housing tower in a city in New Jersey, it was found that one patient had 324 hospital admissions within a 5-year period. It was also found that just 1% of that city's population accounted for 1/3 of its medical costs. This was found in an article written by Atul Gawande in 2011. Research suggests that patients with a lower socioeconomic status have a more difficult time managing their chronic diseases because of poor health literacy and inability to pay for medical treatment. Today, I will discuss 2 points regarding health within the lower socioeconomic population. First, someone that has little to no education is going to have a difficulty learning how to manage their chronic diseases. Second, people that are on limited to no income are least likely to adhere to routine checkups, healthy diets, and routine medications due to cost. My first point is a patient that has a low education level will have increased difficulty managing their health. The website Office of Disease Prevention and Health Promotion identifies 2 key strategies for healthcare providers to implement when providing education to patients with a lower education level. The website says that it's important for the healthcare provider to assess the patient's literacy level prior to educating the patient on the disease process. For instance, the healthcare provider is going to want to assess the patient's numeracy skills to determine the patient's ability to manage his medications and the patient's ability to draw up his own insulin. The healthcare provider also needs to assess the patient's knowledge of general health topics. If a patient that has diabetes does not understand that certain foods will greatly increase his blood sugars, he's going to be least likely to want to follow a healthy diet. Another key element for healthcare providers, according to the Office of Disease Prevention and Health Promotion website, is for healthcare providers to educate patients in a simple but effective manner. This means healthcare providers need to try to avoid using medical jargon and just use plain language and try to give visual examples when possible. Also, to evaluate their teaching, it's important for healthcare providers to have a discussion with the patient to implement the teach-back method. So if a healthcare provider teaches a patient how to use a glucometer to check his blood sugar, the healthcare provider then should have the patient teach the healthcare provider how to use the glucometer. My second point is that patients that are on limited income do not adhere to recommended medical advice due to high cost. As you can see in this chart from 2015 found on the Henry J. Kaiser Family Foundation website, the most common trend upon patients not complying with medical advice is due in part to the high cost of these recommendations. As you can see up here, a majority of patients that have no usual source of care cannot afford health insurance. And these low-income families do not have healthcare insurance because of the cost. Because of the lack of insurance, they then cannot afford to have routine checkups for prevention of care, and they can't afford to take the recommended medications because of the cost of prescriptions. According to the American Academy of Family Physicians in 2015, people that are living in poverty have limited access to proper nutrition. It's much easier and cheaper for these patients to buy frozen foods and canned vegetables than it is for a patient to go to the grocery store 2 or 3 times a week to buy fresh fruits and fresh vegetables. In conclusion, patients with a lower socioeconomic status have a more difficult time managing their chronic diseases because of poor health literacy and inability to pay for medical treatment. Patients with low literacy level have a more difficult time understanding what it takes to maintain a healthy lifestyle. Healthcare and maintenance is too expensive for patients to adhere with the income at the poverty level. Healthcare access and healthcare maintenance can improve for these patients with the implementation of a care coordination team within local hospitals and clinics. Everyone deserves the same quality of health care and the same chance at a healthy future.